Can you fix your vertigo even if you don't know what is causing it? The answer is yes, and I'm going to talk to you about it in this video. Welcome to the Vertigo Recovery Doctor. I'm Dr. Kevin Smith, and I not only want to help you figure out what's causing your vertigo, but I want to help you recover from it. And the best way to get my help is to hit that subscribe button and the little bell next to it to get notifications on when I come out with new and helpful content. So let's talk about this. It's this whether or not you need a diagnosis to start recovering. Now, I see so many patients that come to me months after they started having their dizziness, or even years down the line. And sometimes it's because they're moving through multiple doctors, spending thousands of dollars, and they were, before somebody ever, either referred or recommended vestibular physical therapy. And I'm just, I wish I would have been able to help them when their vertigo first started, because then we would have avoided a lot of the chronic problems that they developed from having dizziness for so long. And this is why most of the time I recommend starting therapy right away. And with the exception of maybe vestibular neuritis, you want to help let that acute phase kind of pass those first couple of days. But after that, as soon as possible, start doing vestibular physical therapy, because it's going to help reduce your risk of developing chronic issues. It's going to help reduce your risk of falling. It's going to help you recover faster and get more back. So the sooner you start doing therapy, the more function you'll be able to get back. Now, let's say that you don't know what's causing your vertigo. You're just feeling dizzy. What you want to look for are what the symptoms that you're experiencing, or what are the symptoms that you're experiencing. So let's say that you're having dizziness in the grocery store. That's my go-to kind of scenario. There is, you got all these busy, and you have this busy environment. You have all these things up and down the aisles in the grocery store, and that visual input is causing you dizziness. Now, there's a visual motion sensitivity that you can start working on. Whether or not you know what your underlying diagnosis is, you can start working on that symptom. Let's say that you're getting dizzy with quick head turns. It kind of, you move your head quickly and it feels like the world catching up with you. That's most likely probably a weakness in the inner ear, or your vestibular ocular reflex isn't functioning as well as it should be. That reflex that keeps your eyes on target when you're moving your head. You can start doing exercise for that, and you can start improving it, whether or not you know what's causing the impairment for that. Now, if you're having a balance issue as well, you can start doing therapy for that without having any kind of diagnosis. If you're feeling dizzy, feeling this rocking sensation that's kind of constant, you can start doing habituation exercises. You can start exposing yourself to situations that make you dizzy, in the hopes that your brain's going to adapt and learn that you don't need to be dizzy in those types of situations anymore, as long as you kind of pace that appropriately. Now, if you're having neck pain or dizziness in certain neck positions, even if you don't know what's causing your dizziness, you can start working on neck issues and start feeling better. Now, what I want you to know about this is that start doing therapy, start feeling better, start improving those different sensory systems. And even if you don't know, if you don't have a diagnosis, starting therapy now is going to help you not only feel better in this moment, but also have a reduced risk of developing chronic issues, and help you recover faster. And so start it in the process of, while you're trying to figure out your dizziness, trying to figure out your vertigo, going through multiple doctors if you're needing to do that, and start with a vestibular therapist or through a program. And if you need help and actionable steps on what you can do today to start feeling better, check out my Vertigo Kickstart mini course. You can find the link below or on my About page. So I hope this was helpful for you. If you have any questions, please feel free to reach out, and thank you for watching.